Welcome to my channel, and today in my studio our usual guest, Dr. Olga. And
it's my honor and of course my pleasure as usual.
Thank you. And it's our pleasure to hear all your knowledge and wisdom and insights on difficult topics, on different topics. And today we had a request to speak on high insulin resistance or insulinemia, and I want to say that long before, we did not even had this topic. We never speak about this. In recent years, we are hearing about high insulin resistance, and people want to know what is high insulin resistance, how it's happening, which symptoms, which signs, and we will discuss how from medical point of view what is insulin resistance, and the first sign of high insulin resistance, it is accumulation of the fat, visceral fat on abdominal area.
Yes, exactly.
And more and more cases we have people of different ages and genders have that issue. So please, Dr. Olga, you put a light on this topic to know it from a scientific point of view, from medical point of view, what is high insulin resistance.
Yes, today's topic is very difficult and controversial, and I'm excited to share my opinion with you, Irina, and I know that you specialize in this very topic, in diet and insulin resistance. You're seeing many patients, so I'm excited to hear your opinion. I'm sure we will reach new insights today. So everyone knows that nowadays epidemic of obesity is accompanied with epidemic of type 2 diabetes and osteoarthritis, particularly of the knee. Obesity is a powerful amplifier of insulin resistance. The risk of type 2 diabetes increases tenfold in obese people. But not all obese people develop diabetes. Of course, environmental factors and genetic predisposition plays a role. So, how obesity can cause insulin resistance? Like Irina already said, accumulation of intra-abdominal fat has serious implications for health. Even some people, they have this intra-abdominal fat like apple-shaped obesity.
Yeah.
And some people have evenly distributed adipose tissue all over the body. Subcutaneous. So intra-abdominal is more dangerous. Obesity is visceral fat is more dangerous than if a person have
subcutaneous
fat all over the body.
1 second.
Yeah.
Subcutaneous fat, it's that in Mauritius we call it lapan. It's that fat which you can palpate it on the top of your body. That is subcutaneous fats. And visceral fat, it is a fat which is accumulated inside our body between organs, which is deep under the muscles, which we can't palpate, but it is inside, surrounding our different organs inside our body, and it's making us to look like full in the abdominal region.
Not only around the organs, but in the organs itself, like fatty.
Yeah, exactly, in the organs also.
Waist circumference in the man, which is more than 102 centimeters, and more than 88 centimeters in women, corresponds with high cardiovascular disease and insulin resistance. Yes, I wanted to ask if you have this. I want to check actually my waist circumference.
Okay,
Because
I don't think you have to worry.
I'm worried, but just in case, let's.
So check. You said 102 for men.
Yes, and 88 centimeters
so
for
if
women.
you check which part of the body we're supposed to check?
Waist.
Okay, this is your waist.
Yeah.
Very thin waist.
I hope I have one actually.
Very thin waist. Okay, this is inches. Other side is centimeter. And it is 76. That is a model waist. Okay, 76, 77.
Okay.
So for women, it should be not more than 88.
No, well, if a woman has 87, it's not good, right?
It's already borderline.
Yes.
So for women, it's 88, and for men is 102.
102. So this visceral fat, why it is so dangerous? Because fat is metabolically active tissue. There are a lot of processes going on. It produces hormones, pro-inflammatory substances, free fatty acids, and all this drains interportal vein and goes directly to the liver, disrupting its works and the metabolism of fats, proteins, and carbs in the liver. Also, these free fatty acids, which are produced in excess in adipose tissue, they compete with glucose as a metabolic fuel. That's why we have a higher content of glucose in the blood and insulin resistance because of these free fatty acids and other substances.
So if we want to fight with high insulin resistance, it means we need to manage our body to become slimmer, to lose the excess fats on abdominal area, and it is automatically going to also influence your level of insulin in the body.
Yes, and other hormones.
So as per my experience, insulin is a fat storing hormone.
Yes, exactly. It promotes lipogenesis, and it makes triglycerides get stored in the body.
So if we want to be in a position of losing weight, that process may happen only when our insulin levels are low.
Yes.
When insulin levels are high, it is very difficult for body to imagine that it can start burning fats, because while insulin is already high, we are already remaining in a fat storing mode. Sometimes we may think that, okay, each individual have different body shapes, and maybe not all individuals want to lose weight. It's okay
they like themselves as they are.
Yeah, they like themselves as they are. They are not sick. They are in a good health.
Yes.
They are not sick. They are telling, I do not have diabetes. I am fine. Yeah, I am overweight, but I am feeling fine. I like myself to be like this. My boyfriend or my husband like me to be chubby, so I don't want to lose weight. According to research, according to experience, we know that one person can be insulin resistant for a period of 10 years unknowingly. The person will not even know that he has insulin resistance before person will discover that he has diabetes. All of a sudden, when there is a regular checkup, they can see, after taking blood tests, they can see, okay, you are pre-diabetic or you are diabetic, and okay, you are 40 years old and you are now diabetic. That person all of a sudden will be like, oh, how come? But person even not aware that already 10 years before that, person was already having high insulin resistance.
And the damage has been already done to the body tissues, especially to the vessels. And the risk of stroke, myocardial infarction is increasing exponentially.
What is a sign of developing high insulin resistance? There can be different signs. One of them for ladies, I know for ladies, it can be happening on their skin, on neck, under arms, sometimes on the face, on the chest. They may have, in Mauritius we call it boule de chair, or it is skin tugs. When insulin is high in the body, the signs of some extra growing of the tissues happening. The first thing that skin tags may start to appear, and it can be at any age. One more sign we can see, it's a dark lines on the neck,
like velvety skin.
and the skin little bit becoming very like hard, kind of changing the structure of the skin.
Yeah.
It can be also under arms or in some also, different folds where the skin
Yeah.
is folding. You can have that dark marks, and it can change the way tissue is, as you said. And of course, when you have, sometimes person can be quite slim everywhere, but there is fat accumulation, especially in abdominal area. Sometimes even it is more healthier for that body to have fat accumulation on the thigh and the hips. Thigh and hips fats, even there is a lot, like a shape, a pear shape, it can be less dangerous than it is apple shape type body where fats accumulated on abdominal area mainly. So how can we usually, according to medical point of view, how can we solve this problem?
The only solution is of course losing weight, and all the health risks of obesity can be reversed with losing weight.
Do everything what can be done for weight loss.
Yes, it's the most easiest and simplest way. So lifestyle modification comes first, and changing of eating behavior.
Eating habits, eating behavior,
Yeah.
and maybe including some physical activity.
Yes, of course. And when we take two overweight persons, and one will be physically active, he or she will not be insulin resistant. But the one who leads a sedentary lifestyle will be insulin resistant.
Oh wow.
So
Very
physical
nice.
activity is the key because it allows non-insulin dependent utilization of glucose by tissues.
Yeah, exactly. So when they exercise, the first thing body will take energy from the glucose which is stored in the body.
Yes.
The fast, so they will be burning all that glucose who is present in the right moment in the body, which present in the muscle tissues, in the liver in form of glycogen. So all this will be burned, which is beneficial. So active lifestyle is
Yes.
very preferable, and any medication usually can be prescribed for people.
Yes, we have medications for obesity, but also side effects profile limits it use. Only a few of them are licensed nowadays, and they are reserved only for those who has high complications. And
Okay.
they also can be used only short term. We have surgery also for severe obesity.
Like a bariatric surgery.
Bariatric surgery,
Yeah.
yes, reducing the
And
size.
I heard that some people using medication like glucophage, metformin.
Yeah, but
it
this is for advances diabetes. But the first stage, like you said, even pre-diabetes, like impaired glucose tolerance. The only solution, if you stop eating sugar, then the problem can be solved without medications, because we have many medications. It depends on your kidney functions and liver function.
Yeah, you need to have all the investigations
Yes,
for
first-
your all your health.
Yes,
States.
and especially obesity, it can have underlying cause. For example, thyroid disease or it's Cushing disease, high cortisol in the body. So all patients with obesity have to check their thyroid function test, their glucose, their lipid profile in a fasting morning sample. So if we prescribe medications, then we always advise patients to follow a diet in combination.
Yeah, and like according to my experience, when I have ladies who would come and say, I become hungry now and then. This is also sometimes when you have high insulin resistance, that is also giving you that symptoms, like the fats we already store in our body want to invite new fats. If you're talking simple language, not a medical language, if you're talking simple language, the fats which we already have stored in our body, it's always want to invite new fats, and you are becoming like chronically hungry. Every time they are complaining chronically hungry.
Yes, people with diabetes type 2, they eat more, they tend to eat more because of this chronic hunger.
I think because glucose is not able to reach to the cells,
Yes.
to feed the cells,
Cells cannot utilize.
utilize glucose, so they're consuming food, but glucose have tendency to remain in the blood and not reaching tissues, and then they're feeling like every cell is feeling needs for glucose and making person to feel hungry. Oh my god, if I will not eat now I may faint. So that's how when they start taking metformin as if opening the cell to let glucose in.
Yeah.
But sometimes if they are not bringing any changes in the lifestyle and in the eating habits, they keep on only rely on medication. After a few years, the dosage to be increased.
Yes.
Because the same dosage of metformin may stop working on for this person, then dosage to be increased, dosage increase, and again dosage increase.
More medication.
More medication. Now, if sensibly we understand that, okay, I have diagnosed with pre-diabetes, now I will take my full responsibility and I will change my lifestyle. I will increase my physical activity. I will control what I'm eating. I will again analyze what I'm eating on a daily basis.
Portion size and
Portion
avoiding
size.
snacks.
Actually, when I'm in yoga and meditation, so our yoga gurus are telling that our size of our meal should not be bigger than this much. Like we put our hands together, this will be size, not like this. This will be size of our, like you put your hand together, this is the size of your meal. And then it should not be a heap, not increase, it should be a little bit flat. So if we consider to change in eating habits, increase some physical activity, lifestyle, also see if can be any stress management.
Yes.
Because some people glucose in blood increasing when they are going
stress.
through chronic stress. Cortisol is high, it's increasing insulin also. So if person is taking in the moment one person is pre-diabetic, person is taking it seriously, is it possible to stop it on that stage when you bring lifestyle changes, you include exercise? Is it possible in the moment you are pre-diabetic, is it possible not to become diabetic?
Yes, it is possible to reverse these health risks and to lower blood sugar only by diet.
Diet and exercise.
Yes.
So when we exercise, we will burn the excess of the sugar, and then we are also controlling what we eat.
Yes, I mean only by diet and exercise without medication.
Yeah.
At an early stages, it's possible to reverse this process.
This is a very good news.
Diabetes. Yeah.
From my experience, I have also experience with people who already been on medication for diabetes, and when they implement those changes, when they change their diet, they start to bring exercise there, they start to control what they eat, what time they eat, how much they eat, portions, they put diabetes into remission. Means they can see that all their blood test is becoming perfect, even that blood test which you do once in 3 months.
Yeah, HbA1c.
Yeah, even that one perfect, and even every week they take their glucose, everything perfect. They can see that already dosage of that medicine they was on can be already
That's a good news.
reduced. But they must understand that while they continue to lead that healthy lifestyle, then only they will be seeing these health benefits. If after they reach already good blood results and everything and health improve, they stop exercise, start eating how they was eating before when they receive the diabetes, when they are dropping everything, lifestyle becoming back to previous one, diabetes also comes back. I have seen it on people. When they take it seriously, till they are going seriously on that lifestyle changes, they put diabetes in remission. As soon as they stop and something happened, some stress happened in life, and they got distracted from that plan that they have to 3 times a week at least they have to go for a walk, or they're visiting gym and they monitoring what they're eating. If by any kind of reasons they stop following that, diabetes come back. And when they come to me and they're telling, Irina, I'm again in a bad shape, I put on weight, my diabetes increased. So what happened? You stop diet, you stop exercising, you stop doing all that lifestyle changes which we already planned to do. Yeah, because that things happen, I changed my job, I sold my house, I had to do renovation, whatever reasons are. But when we by change of lifestyle putting our problem, health issue into remission, we need to know till we end that lifestyle, till the problem is in remission.
Yes, and the worst thing is that diabetes has very serious complications. Like we can lose our eyesight, we can develop kidney failure and nervous system problems. Our legs can be amputated, so we should take this problem very seriously.
Yeah, I noticed that some people is telling, I have diabetes, but it's under control. Under control by medication or under control by lifestyle? Because if we count only on medication, then we don't know what is happening background of medication. We need to, even if you are on medication, you need to bring some hard work for
you cannot rely only on chemical.
Yeah, only on medication. If we are relying only on medication, then we can blame only medication. If we can take some steps by ourselves to improve our lifestyle, then we will be feeling satisfied and proud that we are improving our health, we are contributing to our body, which will thank us after.
Yes.
The more stronger muscle we have, the more better metabolism.
Yes, because muscles are utilizing the glucose also, first of all.
When someone is affected by diabetes, what happens to their muscles?
So diabetes affects all type of metabolism in the body: carbs, proteins, and fats. Proteins are broken down, which will manifest itself in decreased muscle mass, in slower, impaired regeneration of tissues, in proneness to infections, systemic infections, skin infections like fungal, hidradenitis, which is inflammation.
They may develop some skin issues.
Yes, skin
Diabetic
issues.
people
Yes.
developing skin issues.
Inflammation of hair follicles and sweat glands, especially common in diabetes. Also ulcers, usually on the feet and on the legs.
And how it's happened that they are reaching to the stage of amputation?
Yeah, because their wounds are not healing.
Wounds are not healing.
Immune system is not working properly because of breakdown of proteins.
And also because of blood circulation is not proper to that
Impaired,
regions.
yes.
To that regions.
Yes,
The nerves also does not
Nerves
function.
are affected, yes, and blood vessels also.
So sometimes we may hear that diabetes is called silent killer.
Yes,
In
that's
the-
true.
In the same time, it may look like everything is fine, but behind the scene, something happening, some organs are continue to get
Yes.
affected.
Like you said, for 10 years, person doesn't know about that he or she has impaired glucose tolerance, like antecedent of diabetes, but damage has already been done.